Thank you for coming on the Wellness Hub. Will you tell the audience who you are? Because you do some amazing work. You're an amazing person, and I thank you for coming on. So, who are you? Who can you share your magic with the audience because you are magical?
Well, thank you so much, Marcia. Thanks for inviting me. My name is Mukunda Abdul-Mbacke. I am a physician. I would say the most important job that I have, though, is being a mom. So I'm immensely proud of my three boys, Kadeem, Isaiah, and Gabriel. I am a healthcare provider. I am a activist. I'm a daughter. I'm a friend, a niece. I'm very connected with my family and with my community. And I would love to share with your viewers and the wider population, issues that women face and specific issues that Black women face. My passion is that I'm an OB-GYN, so I'm blessed to be able to help women in some of the best moments in their lives, and sometimes in some of the darkest moments in their life. Losing a child can be immensely painful, and I've been there for that. And then I'm also there when we have healthy baby boys and girls that are born and help become part of a family. So the highs and the lows, but I definitely feel like my work most of the days doesn't feel like work, just because I enjoy what I do so much.
So, I've read somewhere. How did you know that you wanted to be a doctor? I read a little bit about your story, and so I wanted you to share, because sometimes we hear the stories of, oh, I knew I wanted to be a doctor at 3, right? And so then there's other people who are like, so I switched and I decided I wanted to be a doctor and I wanted to start studying medicine at 30, right?
Mhm.
What is your story? Because I know you're passionate. I want to tap into where you are being an activist, and I think it's amazing where you are and how verbal and vocal you are, because I think that matters in the space of a patient, right? To know,
Mhm.
kind of know where their provider stands on things. And because you're in spaces that I might not be able to be in, and to know that you may be advocating for me in a space that I can't potentially sit.
Yeah. I have been blessed to be able to go into a lot of different spaces, but I think the most cherished space for me is in the room with the person, in the
Right.
room with just sitting down and talking to another woman is just the best. But I sit on national boards. I have been blessed to get to know our two senators, Senator Mark Warner and Senator Tim Kaine. And because I've been an advocate, because I sincerely want better health outcomes for our community and for people that look like us. So interesting that you should say age 3. Yes, age 3, I started saying that I wanted to be a doctor, and I'm a child of the '70s, so there was Sesame Street, and all I remember there were things on Sesame Street about uh, being doctors and just the white coat. And then I also remember growing up in Harlem that we had a dentist that used to come to the school. I went to PS 133 in on 125th Street, and there was a dentist that used to come every couple of months, and they would have the white coat and all these like shiny silver instruments, and I just thought it was the coolest thing. The funniest thing is that if you come to see me in my office now, I will not be wearing a white coat. I might have my jean jacket on. I might just have on a t-shirt. But for some reason, 3, 4, 5-year old, 6-year old Mukunda just was like, in love with this white coat and the shiny instruments. And so it was from there that I began thinking I wanted to be a doctor. I had other things. I also thought I wanted to be Wonder Woman. I also thought I wanted to be a baker. When I got to Yale and got my butt kicked in my intro science classes that first year, but I was doing really well in my English classes. I thought that I was going to switch and become an English major and teach English, or be in the classroom. And then I really had to have one of those, like, man in the mirror type moments where you look at yourself and you try to know what ultimately is going to make you happy. And I'm happy that at 18 I had some type of a grip about what I thought would make me happy long term. And when I looked at myself in the mirror, I knew that teaching English, like correcting papers and reading books into my 50s and 60s, was not going to be for me.
Right.
Like, it, certainly if that's your buzz and that's what gets you, do that, but I knew it was not going to be for me. And so I had to just lock in and be, really understand what it was going to take to become a doctor,
Right.
and lock into those classes and lock into studying so that my grades could improve so that I could get into medical school.
Right.
And I did that, thank God.
Okay.
But
And
that's
did
kind
you
of a portion of the story.
and did you know you wanted to be a gynecologist? Did you know you wanted to be OB-GYN, or how did that come about?
The funny thing is, I still get to see young people in my practice, and so uh, all the time, most of the time with young people, they always want to be a pediatrician because they always want to help other young people, and so I think that's a cool thing. And one other thing that I will say that, as an aside, one of the best things about growing up in a Black community like Harlem was that once people knew I wanted to be a doctor, they would address me as doctor. So they were already
Oh,
claiming it for me. So they would come to my mom's store and be like, "Where's the little doctor?" And, "Oh, I want to see the little doctor." And they already were telling me these things. And it's the same thing that I see happen for my son. One of them the youngest one wants to be an astronaut, and so people always are like, "So how's the little astronaut, and what's the little astronaut doing?" And if you are that person, if you're from that generation, if that's the way you speak, keep doing it, because our kids get so much negative things fed into them about what they can't do. And having people in their community that may not be their direct family, may just be truly kind of just strangers or acquaintances, but having those people speak life into your kids is so profound and amazing. So yeah, all throughout if there's ever anyone from the 70s in Harlem, the little girl that you used to call the doctor did become a doctor. So as far as OB-GYN, I thought, like all the other little kids, that I wanted to help little kids, that I wanted to be a pediatrician. And as I got to become older, I thought a little bit more about adolescent medicine, because unlike most people who can't stand teenagers, I actually really do like teenagers. I think um, they're funny. They're becoming, like,
yes.
they're trying to figure out these things, and they have ways of looking at the world that will just blow your mind, because you can't, like, I'm on the other end. I'm in my 50s, so I can't see the world like a
Right.
16-year-old. And so I love talking to them and listening to them. But I did not per se do adolescent medicine, and I did not do pediatrics, because I finally did my rotations on those services. And I like to just have one patient. So you remember, the most sacred time for me is in being in the room with just the one patient. Pediatrics is not that. You have to manage the parents and the child, and sometimes those are like, it's oil and water. Sometimes you're getting a different story from one group. You don't
Right.
know what the self interests are in each set. it was too much. And so for me, that wasn't what was going to be the best for me. And so, OB-GYN just speaks to my soul because you get to work with healthy people for the most part, and you're dealing with people in a good phase in their life. Like something is growing and they are happy for the most part. I mean, I don't want to paint a rosy picture, too rosy a picture, because a lot of horrible things happen to women. So I see women who have been drugged and raped. I see women who have been physically and mentally abused. I see the results of that. Like sometimes it literally will take me 30 minutes to do a pelvic exam because I have to develop this trust. I have to help them know that I'm not there to hurt them, that I'm trying to help them. And so there's a lot that goes into being an OB-GYN because there's a lot that goes into being a woman.
Right.
And so I get all of it, but in general, when I think about why I went into it, it's because for the most part, it's good times.
Okay.
It's helping someone grow this little person inside of them, and then helping them deliver that little person, and having that little person become part of a family. So those are the things that are like the real drivers for me within OB-GYN.
So my question is if somebody's looking for a provider to help them navigate the pregnancy, what would be two things or three things or even one that you would advise a patient that is looking for someone to navigate and to guide them through that place, maybe a new place they haven't been pregnant before? What would be something that you would recommend?
I mean, I would say don't be afraid to trust your gut, because I think a lot of times people are like, oh, well, they're the doctor, or, I tell people all the time, there's only one you, like, there's only one Marsha. You know your body better than I do. I'm only seeing you for 15, 20 minutes once a year, maybe a couple of times a year.
Right.
So if there's something that's going on that you're concerned about, you need to tell me. I'm here to listen to what your symptoms are, and then the two of us together try and figure out what it could be. But I'm not, it's not, definitely get someone who speaks to you where you're equal, where you're an equal participant in your care, because you have to be. I'm not going home with you. I can't make you do certain things. You have to buy into what I'm telling you. There's sometimes people will tell me, you know what, I don't like birth control. I don't want to be on any birth control. I don't like the way it makes my body feel. I will still tell them all their different options, and then I will tell them, okay, so what are we going to do if this is not going to be an answer for you?
Right.
Just so that they own their decision. So if 6 months from now they're pregnant, that's fine, because they own that decision to not be on birth control and still be sexually active without any condoms or
Right.
anything. Like, it's all about owning your own decisions,
Yeah.
as long as you have the knowledge. So I think the biggest thing would be, how does that person speak to you? Do they speak to you as an equal? Because you are an equal, right? Like, first of all, first and foremost, I believe that we're all children of God. And even if you're not in my same faith, I just know that I feel that you're covered by that same thing. So
Right.
I don't view myself as up high and you down low. I know that I have more education in medicine, but I don't have more education on your body and what you're feeling. So you are the chief executive officer for your body, and being able to tell me what's going on with you. And then I can use my education and my knowledge to kind of develop a pathway
Right.
for you. But we all got to be on the same page. And
Right.
so if you can find someone like that, that's not kind of spitting out a whole bunch of medical jargon, because I mean, I could flip it, and I could talk about your fifth metatarsal and your adenomyosis and your endometriosis and
Right.
a whole bunch of long words that you most likely will not understand. But why do that?
Right. Yeah.
Like, why, like, why leave the doctor's office with 6 or 7 words that you don't know what they
Right.
mean, when there's ways to explain it so that you do understand. So I think that's the biggest thing. And I think realizing that we don't know everything. Like,
Mhm.
um, sometimes things are easy, and we, like, I have a patient right now that I am transferring to UVA to get some other feedback, because we've tried everything to stop her bleeding. She's a young woman in her 30s, and her bleeding and her periods are just horrendous, and she wants to have a child. So the easy solution would be a hysterectomy or an ablation, which would destroy the lining of the uterus.
Right.
But that wouldn't be accomplishing what she wants. She wants her bleeding to get regular, so it's not controlling her life. And I mean, she's at the point where she's needed transfusions. Like, it's that bad. Yeah. But I can't get my finger on it. I don't
Right.
know what it is. And so we're going to try to get her set up at UVA to see if some other minds together can figure out, because that's, you want to, in a different doctor in a different setting would have just been like, we've got to do a hysterectomy, and just bump that you want to have children, you're bleeding, it's not going to be, the way you're going now is not sustainable. But at least she came to me, and I'm really trying to put the two things together, like wanting to have this baby in the future, and we need to be able to preserve your uterus as much as we can.
I'd like to hear that. I love hearing what you just said in terms of they are the CEO of their body, right? You're the expert in medicine, but meeting them, being able to have it equal, right? I think that's big. And then also what I love where you're saying, hey, what are you trying to attain? It's all about your choice. And if I can, like that patient, you said she's been bleeding, she wants to have a baby. Hey, I've done everything I possibly can. Let's see what we can do. And I like that. And I'm not saying, in stories that I've heard, right? I'm not in medicine, but sometimes it does not. Like you said, if it was another doctor, maybe a doctor said, hey, the only thing that we can do is surgery, right? And I think that's big. I think people think in medicine because sometimes the way people look at doctors, right? It's this hierarchy. And they don't think that they have a choice, or because they don't know these things. And I think sometimes they don't know how to advocate or ask questions because they may feel less than. But one of the things that I know that I like for me, for you, like what you do is, hey, let's talk about it, right? Look, what are you trying to do? And then you get to put your expertise and your knowledge and your skill set there and saying, hey, these are the things we can look at. And I think that's really important for people who don't feel like they have agency, to then look for a provider that thinks that way, right? I
Hmm.
think that's really important. So I appreciate that. I really do like that thought process with that. So
I guess it becomes also difficult, because I think I read something where 60% of Black women felt that they were discriminated against within their healthcare um, interactions.
yeah,
So that's such a large body of women. And, in a place like where we're at, it's not like you have that many
yeah,
providers. So then, are you going to travel to Roanoke? Are you going to travel to Greensboro? Are you going to go 3 hours to Charlottesville? Like, what are you going to do if you
right.
feel disrespected?
Yeah. No, and I think and that's interesting. It is, and I think sometimes is that the way they should be treated, right? I think sometimes, but is it me, or not even having the sounding board to even communicate their story, thinking about where we are, right? Um, of, well, I just need to go in here and get this service. Or sometimes, it's maybe fearful of getting that service. Like you said, right? There might be trauma, the different type of patients that you've seen. Um, but what does that look like, right? How does one advocate? But I think, and we've talked about weathering, right? We've talked about
Mhm.
just those, what stress looks like, what cortisol looks like in the body from a 19-year-old to our ages, right? And and I know we were talking about how to have agency, how to build community. And I'm wondering, right, like you said, in Harlem in the 70s, right, there are people who are already saying, hey, where's the little doctor, right? What does, when I think about it, how's community really impact your health? And how does community help one navigate mental health things that we all encounter, to be able to communicate what they need or having questions and have an agency over their health, you know?
I mean, that's a lot to bite off, and it's personal conversations that we've had a few times.
Right.
And, I attempted, and I'm still working on developing this focus group, and maybe I'll get some assistance this summer. So it's not dead in the water, but it does require regrouping, because in wealthier communities, because again, I do travel in different places. So I home is Martinsville, Henry County, but I also go down to the Lake Norman area outside of Charlotte, which is very affluent. Now they have mommy groups. I will see a group of moms all pushing the strollers, or walking around the park to get some exercise and stuff like that. Why don't we see that in Martinsville, Henry County? What would it take for us to develop that? It's something that I would be interested in trying to dialogue about, to help people. It just seems like, yeah, there's just been a lot of dissolution of community in our particular
Yes.
community. And people really need to understand there's stuff that you get, there's energy that you get from being in real life, as opposed to telecommunications, social media. Like, yeah, you can find out what Cardi B's doing with her 2-year old, but how relevant that's going to be for your life in Martinsville, Henry County, I don't know. Um,
Something that just came to me
go ahead.
is I'm wondering, right, when we think about the participants that could benefit from a focus group or the idea of community, and I know we've talked about church and all that, but I'm wondering if it's going to their jobs, like human resources, like
Hmm.
doing something around that because they're there. And if there's something, a way to communicate to human resources, and I know it's a little finicky around focus groups, right? But I'm just wondering if it's meeting them where they are. When I think about people that we've talked about, right, of the exhaustion level, and would they
Hmm.
ever really be able to come to a session because of the jobs they work or the exhaustion level, them not knowing that it would be beneficial? I'm wondering, and maybe this is something we can talk offline of, how do we maybe reach out to 3 to 5 different human resources departments of the bigger agencies or organizations that here with employees, and what does it look like having something around that, that topic? Um,
I mean, people are just, I think it's a combination of trust, and like I'm reading Their Eyes Were Watching God right now, and this is like the early 1900s set in the South, and even then it just was like the tongues are wagging, like just always people watching and ready to talk about you. And I don't know, I think that's kind of what the biggest fear is just, how can I let down my guard? How can I ask for help? How can I be transparent? Like, I don't know if you saw this on Instagram, but I mean, it's a story that it's it apparently that it's true because other people wrote in about it. But basically, this young mother asked her baby daddy, "Could you please come and get the kids? I have been with them for more than 7 days nonstop, and I just can't take it anymore. And I really need for you to pick the kids up." The text message went unanswered. She ended up killing herself and the kids. And that, yeah, just the same expression that you made is like a punch in the gut. Like, how could our systems be so broken
Right.
that even missing one text message was the end for three beautiful lives? Like, if it was even me, and I would leave the house right now to pick somebody up, to help somebody. But it just seems like it's hard for people to ask for help. They don't know who to ask for help from. They're they're prideful that because even with the community, there's going to be some money to get some community maternity health workers. But even in the meetings that we've had, we wanted to make it clear that you can tell us that you need help with food without being fearful that we're now going to report you for neglect.
Right.
Because there's always that issue. Like, if I let you in my house, if I let you know what's really going on with me, you know, what's going to happen?
Right. Yeah. No, that it's like, where do you start first, right? Because I think communication, I think when the pandemic happened, I'm not saying people weren't asking for help, but I think we had to fend for ourselves in a different way when things got shut down. And I
Hmm.
think now it's so much harder to open back up. I don't think we haven't recovered, but I don't know if we know how to recover. But I know the one thing that we do need is community, and we need to like touch. We need to be able to hug. We need to be able to the hug to release oxytocin, right? Like
Hmm.
we need to be able to ground, um, and it's hard. I think community is big. I think when we navigate anything mentally, mental health and physical health, I think being able to have a community around us um, is really important. Yeah.
No, completely. I mean, and I think we're going to be talking about this till we all are completely gray, because it's so hard. And because even when I'm talking to my friends, they're like, "Well, to get your focus group together, is there a group where they're already meeting? Is there something you can hand the flyers out to?" And I was like, poor Black women in rural areas don't have book groups. Like, they don't have things where they come together at. And as I said, we need to figure it out,
Yeah.
because it doesn't exist, but that doesn't mean it's not necessary. And I think the work that you have been doing with the sound baths and the yoga is definitely a good beginning. I felt
Yeah.
like we touched upon something with that.
Yeah. It's just, I think for me, it's figuring out a flow, but also a space. Because I have to say, as a person, like it takes a lot to lug it, right? Like just traveling, just like you said, your friends will be like, "Hey, well, can you go hand out a flyer?" I think for me in that space, sometimes there's heaviness, and I want to be able to, as a therapist in me, I want to be able to facilitate the heaviness. I don't want, I know we can relax, but now we've brought up words and kind of how do we facilitate to be able to get them to talk about the heaviness. But then I think what happens is the fear of, is somebody gonna go talk about me? Like I open up the fear of, the judgment, because, now I'm crying. The last time that I did have that, somebody was crying and she was releasing and never had experienced it before. And she had gone through a lot. And then there was a couple people that were like talking about it at the end. And I was just like, she experienced a release and healing. And I know as a person, I become territorial over that because healing is healing. Like it's as strong as, in my mind, um, or stronger than medicine, like
Mhm.
pharmaceutical medication, right? And so, um, it's finding a happy balance or finding a balance so, people can experience healing, but also have a space to talk in depth. Yeah,
Mhm.
yeah. So, is there anything else? Is there one thing that you would, because you've dropped a lot of gems. Is there one thing that you would like to for the listeners to take away from, the one thing that if they can take anything away from this space in this conversation?
I would want them to know that you are important, that your words, your thoughts, your deeds have value, and to each day try to search out the best in yourself and the best in others. Like, always assuming the worst kind of ends up being a vicious cycle. And so it can be challenging, but give yourself that grace to make mistakes and to recover from them, and then really look for the best in different situations. Many times, 99% of the time, it usually is not about you. It's usually about something else that the other person is dealing with or going through. And so that would be the gem. And yeah, like if there are people who see this who have ideas about community, or they've done some work in their own communities that have been impactful, we would certainly like to know so that we can learn how
Yes.
to improve what we're doing.
And so then where can people reach you? Where are you anywhere on the internet? Where are you? Where
Where
or
am I on the internet? Let's see. I am on, let's see, we have the Arise Women's. I probably have to send it to you, but
okay, that's fine.
it's, yeah, that's what I'll have to do. Because I sent you a tag because when I signed up for this, yeah, it's a Arise Women's Institute is
Okay.
on Instagram, and it's just
Awesome.
all one word, Arise Women's Institute.
Okay.
So they can
Well,
find me on that.
I thank you so much. We will definitely have you back if
Okay.
time permits. And yes, thank you for sharing your joy, your magic, and just you being you. And I appreciate it.
All right. Thank you so much, Marcia. See you.
See you.